As I've said, I'm a cataract surgeon. Cataract is one of the eye diseases, and it's the main blinding condition worldwide. It is estimated that more than 90 million people are blind in the world or have low vision because of various conditions, but half of that is because of cataracts. So the magnitude is big. More than the Kenyan population worldwide is blind. I'm glad most Kenyans are coming to the hospital early now when they start losing vision, and we can reverse the problem before you become blind. We also recognize that the previous technologies were not very friendly. You had to change your lifestyle once you had cataract or had cataract surgery. But now you may have surgery without people knowing. We have developed to a point that we don't give you an injection, we don't cover your eyes, you just have the surgery and you walk home. Inside your eye, there is a lens, a natural lens that you are born with. With time, mostly with age, people above 50, the lens becomes cloudy. And when it becomes cloudy, light cannot pass through and cannot be focused on the retina behind. That then means that your vision becomes poorer, and as the opacity increases, the more blind you become. Brings cataracts. I've said one of them is age. The others could be eye diseases. Some eye diseases would end up bringing cataracts. Some treatments we give to the eye may end up giving you a cataract. So it's better if you have an eye problem to visit an eye hospital, because we know what can bring problems, we know how to modify it, and we know how to follow it up so that should it happen that you have cataracts, we can treat it. We have two types of cataract surgeries. One is a bit of the previous generation, and then we have what we are currently practicing. The previous generation was a simpler way of doing cataracts. You had to make a slightly longer wound to remove the diseased lens and put in a new lens. What we currently practice is a small incision with a foldable lens that we put in, and you go home, you won't even feel much pain. Cost implications, costs vary and things vary, but for us here, we will ask of you to pay 60,000 for the most modern type of cataract surgery that will alleviate your problem. But in cases of complicated cataracts, in cases of where affordability is an issue, we still have the previous generation of cataract surgery at 30,000, which is quite affordable for the procedures that we do.
Interesting.
Yeah.
Now, do you use NHIF?
Yes, we do, among other insurance providers, but NHIF is the bedrock of our work. And I think we are among the major eye care providers in the country under the NHIF system.
Naweza, kichwa saa ingine inauma, lakini unajua huwezi kujua sasa kiini ya kichwa, kiini yake ni nini. So kawaida ni ile kitu imenisaidia sana kufanya hiyo shida, kutatua hiyo shida ni hiyo, at least kupumbua kwamba jicho moja ndiye yaone. Lakini haijakuwa na ile challenge nyingine nzito sana ya ambaye na maumivu tofauti ya mwili. Fortunately, actually, let me be very honest, sijakuwa mgonjwa mimi kwa muda mrefu. Hata sijawahi kufanyiwa surgery yoyote tangu nizaliwe, na hii ndiyo itakuwa my first going to theater. Ndiyo hii itakuwa siku yangu ya kwanza kuingia theater. Kwa hivyo ni hapo nashukuru Mungu kwa upande huo, lakini Bila shaka matibabu iko na mahitaji ya pesa mingi, na NHIF pia I think bibi yangu pia kwa kazi sasa, kadi yake anatumia sana NHIF.